Hello, now we're going to start the scapula. I love this bone. It's a beautiful bone. And your first job is to determine whether this is a left or right scapula based upon some of its bony landmarks. If you look at the lateral view, this will have a little bit of a concave surface, so you know that this is anterior. We'll start with the posterior surface, which is also called dorsal surface. So this is the back, the posterior side. You've got the spine of the scapula, which you can palpate on your clients. Right here is a little bit of a socket. This is called the glenoid fossa, and this is where the humerus sits in to create your shoulder joint. So you know that this has to be the lateral surface because the shoulder is on the outside. So this line here would be the lateral border. It's also called the axillary border, which would make this border is the medial border, and since it's closest to the vertebrae, it would be called the vertebral border. Comes to a point at the bottom. This is called the inferior angle. If you travel all the way up the medial border, you'll come to a point at the top, and this is called the superior angle. Where the spine of the scapula starts on the medial side is called the base of the spine. The base of the spine can be located because it's equal to the level of T3. The superior angle is located at the level of T2. If you were to count on your vertebrae, 1, 2, 3, 4, 5, 6, 7, that's the cervical spine. 1, 2, and 3. So it's approximately at T3 and T2. You'll have about 2 to 3 finger widths between your spinous process and the vertebral border, and that's where your scapula sits on the rib cage, about that far out. On the lateral border, just below the glenoid fossa, is a tubercle, and this is called the infraglenoid tubercle. On the top, it's the supraglenoid tubercle, infra being below, supra being on top. If you look at the top view, this is the medial, this is the lateral. There's a fossa right in here, and this is where the Starship Enterprise goes. This is called the supraspinatus fossa. Just below it would be the infraspinatus fossa. There is a supraspinatus muscle and an infraspinatus muscle, which makes it very easy. If you follow the spine of the scapula all the way to its lateral edge, it becomes flat and creates a little bit of a hood over the glenohumeral joint. And that is called the acromion. That's actually where the clavicle articulates with the acromion. The anterior surface slides along the rib cage. This is also called the costal surface because of the ribs. This area is also called the subscapular fossa because subscapularis muscle lies along this part of the bone. You'll notice in front of the acromion is another big bony protuberance, and this is the coracoid process. And you can actually palpate this on yourself. It's where 3 muscles attach: pec minor, biceps brachii, short head, and coracobrachialis. So this is an important bony landmark to pay attention to. And that is our scapula. Chromium, spine, superior angle, inferior angle, vertebral border or medial border, lateral border or axillary border, glenoid fossa, infraglenoid tubercle, supraglenoid tubercle, coracoid process, supraspinous fossa, infraspinous fossa, subscapulous fossa. I think that does it.